Some bodies mark borders as the boundaries of nations, marking other bodies as burdens to be banished to protect the clean bodies from contagions. Moving bodies are labelled risk, never at risk, despite being more likely to contract infection once in Europe, because it turns out border security is not another way to say concern for well-being in any European language. But not all moving bodies are deemed risky, it just depends how you move, because airport lounges remain open for moving bodies with the right passports, athletes and journalists travel for the Olympics, whilst borders remain impenetrable for the poorest. Some bodies mark borders as the boundaries of nations, marking other bodies as burdens to be banished to protect the clean bodies from contagions. And the contagions are also known as the stealers and the pilferers, synonym for health tourists and terrorists, threats to be forcibly quarantined, problems to be offshored, diseases to be deported and dumped elsewhere, but never people to be cared for. Duty of care applies only to those deemed deserving. Stethoscope in one hand but keys to a cell in the other. Do you have the right papers? Sorry, it's just procedure, it's just border, it's just hoarding resources from bodies birthed by the bodies they were taken from in the first place. Do you have the right papers? Sorry, it's just procedure, it's just border, it's just making more vulnerable the people who left home due to their lives being at risk in the first place. But do you have the right papers? Sorry, it's just procedure in a world where some bodies mark borders as the boundaries of nations, marking other bodies as burdens to be banished to protect the clean bodies from contagions. So produce the documents or produce capital, but do not produce children. You're either product or provider to be punished or primed for productivity, but not a person to be cared for. Never a person to be cared for. So parents plan pregnancies around bureaucracy, families plan reunification around documentation, but they can never plan to be cared for. Just a body to be worked until its health gives way, to be housed until its visa expires, to be needed until the global market fluctuates, to be invisible until we require another scapegoat. Just as language makes them lifeless, the law makes such people illegal, stoking fear more infectious than any virus to distract us from the systems that are so lethal. Stay at home is an empty phrase to the homeless and forcibly displaced, because hostile environment does not translate to care in any language. No. Care is when we resist to conform to the claims that people are contagions, that bodies are burdens, and that our health is not co-constituted, and that exclusion and alienation are a route to anybody's safety. This is not a state of emergency, it is a capitalist state. And if the nation is a body with health to protect, that is only because the bodies in its underbelly are so neglected. There is no word for care in a language that erases and denies. Care requires an entirely different vocabulary, an entirely different set of circumstances, an entirely different world. Because when the environment is hostile, only a new ecosystem can possibly create conditions of care.